Hi, Assalamualaikum. My name is Anis Farhani binti Hafiz Nordin. My metric number is 069533. Today, in this video, I will present about osteomyelitis. What is osteomyelitis? Osteomyelitis is an inflammation and infection of the bone. Bones can become infected in a number of ways. Infections can reach a bone by traveling through the bloodstream, or infection can begin in the bone itself when an open fracture or surgery is exposed to germs.
In children, osteomyelitis affected the metaphysis of long bones like femur and humerus. In adult, osteomyelitis usually affected the vertebrae, hip and foot. Osteomyelitis is caused by bacteria that called Staphylococcus aureus. These bacteria can enter the bone through the bloodstream, infected tissue or open wound. Bone is normally resistant to infections, but certain conditions can increase the risk of osteomyelitis, include poorly controlled diabetes, pulmonary tuberculosis, sickle cell disease, surgery to replace broken bones, intravenous drug use, chemotherapy, recent injury which has puncture wound through shoes, and having urinary catheter.
Pathophysiology of osteomyelitis. First is start with the bacteria reach the bone to cause infection, and then actually bacteria is reach the bone through the bloodstream, which is we call as hematogenous spread, and then through the bloodstream microorganism may reach specific places in the body, and then once the bacteria reach the bone they will start to proliferate, and then the inflammation may occur.
Osteomyelitis can be classified into many ways, based on symptoms chronology, duration and based on Tierney and Mader classifications. For symptom chronology it is divided into acute, subacute and chronic osteomyelitis. For acute, the disease has been less than 2 weeks. For subacute, usually it is hematogenous osteomyelitis, which there is lacking in symptom and it is delayed for more than 2 weeks. For chronic, it is defined as persistent pain, erythema or swelling, mostly last for more than 4 weeks. Next is classification based on duration, or known as Lew and Waldvogel etiologic system. There is 3 category. First is hematogenous osteomyelitis. Originated or transported by blood mainly due to bacterial infection. Most common etiology in children. Contiguous spread, which is from direct inoculation caused by trauma or penetrating injuries, prosthetic devices, open fractures and surgical contamination. Last one is osteomyelitis secondary to vascular insufficiency mainly due to reduced blood supply, which is common in diabetic patients. Tierney and Mader staging system is another classification of osteomyelitis which can be divided into anatomic type and physiological host. For anatomic type, there is 4 stages. Stage 1 is medullary. Infection confined to the intramedullary bone surfaces. Stage 2 is superficial. It is true contiguous infection. Stage 3 is localized, which is full of thickness, cortical sequestration, and stage 4 is diffuse, through and through process requiring intercalary reconstruction of bone. Next one is physiological class. There is a host, B host and C host. Some osteomyelitis gives symptoms and some don't. The clinical features of osteomyelitis is severe pain in a specific bone, swelling around the affected bone, redness, warmth and tenderness in the affected area, fever, chills and sweating, irritability or lethargy especially in young children, and drainage from an open wound near the infection site or through the skin. Next is investigation, including diagnosis or findings of osteomyelitis. Osteomyelitis can be diagnosed by complete blood count, X-ray findings, bone scan or MRI, and bone biopsy. And from the video, the findings or result is like below. These are the pictures of X-ray of osteomyelitis. From left, the X-ray film tells there is lesion in the distal radius. Next, there is focal osteopenia as the 5th proximal phalanx base. And the right picture shows the involucrum and sequestrum. These is the medical imaging resonance aka MRI picture. Pictures below shows there is small collection of fluid in the left picture. So, what are the doctor's management? Doctor management can be divided into conservative and surgical. For conservative treatment, take antibiotics for weeks, which the antibiotics is directed at organism causing the infection. Next is surgery. Surgery is basically focus on the affected area. There is also surgery of removal of sequestrum or sequestrectomy. This surgery mainly to draining abscesses.
Next is the physiotherapy management. For acute osteomyelitis, physiotherapist can tell patient to wear proper splinting of affecting joints in functional positions. Then, elevate affected limb to control edema. Cryotherapy can help in reducing pain and spasm. After complete cessation of pain, mild isometric exercises are prescribed for affected joints. Then, can mobilize joint and strengthen the muscle like active-assisted, active and resisted exercise after disease is completely arrested. For chronic osteomyelitis, deep ultrasonic massage can be applied for adherent scar. Strengthening isometrics and isokinetic exercises for the muscles. Can do range motion of exercises like active and passive. Used assistive devices. If there is deformities, can be corrected by various orthotic devices. And if the patient ball limb length discrepancies can be corrected by shoe raised.